donning and doffing and demonstrating that for us today. So this session is designed, the purpose of the session is that at the end of it, we'll talk a little bit about your fit tested respirator and how you find it. What is the PPE specifically needed, how to safely don it, and how to safely take it off. And what constitutes a PPE breach, as information now is emerging around what do we do if there is a staff high-risk exposure through PPE breach. So we can cover that as well. So we'll talk about fit-tested respirators first. We all know by now, correctly fitting PPE is one of our greatest defences against airborne illnesses in the hospital setting. We've talked in the forum already about tea rooms, about where we have staff congregating and when we're eating and drinking, and how important it is that we use PPE correctly in those spaces. We're now majority of us in N95s. So for those, I may not go through these because usually this is what we use when we have face-to-face session. Do you know, there's 3 things that you need to know if you've been fit tested. If you've been fit tested, there's 2 things you need to know. Do you know which are your 2 designated fit testing respirators? Do you have your card handy so you don't need to remember? But also, the 3rd point is the most important one. Do you know where to access them when you need it? So if you can't answer those 2 questions, please find out ASAP. Because following your fit test, it's your responsibility to wear only the masks that you've been fit tested to, and then to perform a fit check, which was also mentioned in the staff forum. And we'll go through fit checking in this presentation. To perform a fit check every single time you don a respirator. If you're unsure, contact the ward or area manager of the clinical area where you mostly work. Okay. So if you need to still book a fit test, you can go to HealthPoint and you can click on book a fit test in HealthPoint after you click the COVID-19 information tab and book your fit test there. So the signage that you'll see in a red zone or outside a COVID area is this precaution signage, which is for all confirmed, probable or suspected COVID-19 patients. The other signage that you will see that you will refer to if you need to. It's not a test to know how to don and how to doff. It's there for you to follow. So there are 6 steps in donning, and your equipment must be donned in this order. There are 2 moments of hand hygiene when you're donning, one before you start and one just before you put your gloves on. When you're doffing, there's 8 steps to doff correctly, and it must be done in this order. And after you doff each piece of PPE, you must perform hand hygiene each time. Therefore, there's 4 moments of hand hygiene when you're doffing. So 6 steps on, 8 steps off, follow the signage. So PPE audit data, we have audited our practice as a group in December 2021, and currently we're sitting on a compliance of around 60%. Getting it right. So we've got a bit of a way to improve our practice, and I can talk about how we're doing that towards the end. Correct PPE practices we know are essential to prevent the transmission of COVID in our hospital community. So COVID PPE breaches is where a healthcare worker is suspected or known to have a breach in PPE. A risk assessment is performed by OSH. Actually, these slides is a little bit outdated. It's actually performed by OSH, not IPNC, for a staff exposure. And an assessment is made of the scenario. Some examples of PPE breaches include breaches that PPE that's damaged during patient care may be a breach. A failure of the healthcare worker to wear the appropriate PPE, especially respirator, and incorrect donning and doffing. So the next 2 slides, I'm going to briefly show you some of the audit results in some detail, just to show how we can avoid PPE breaches occurring. Any breaches, as we've heard in the forum, are reported immediately to the shift coordinator, who will advise the staff member to complete the online form, which will be available very shortly. And this process is also outlined in the policy. Just on breaches, we're sending PPE spotters out into the clinical areas to support PPE donning and doffing. One example recently was a staff member who was doffing, who was noted to doff the respirator that they were not fit tested to. So when we followed that up, fortunately, that was not the respirator they wore in the patient's room, so it was not a breach, but that's where we're trying to support staff and pick up any risk of breaches. The audit data, we did audit in 2020 as well. The audit data showed the areas that we really need to improve on is when we're fit checking and also with our protective eyewear. But I would think over the last few weeks that we're becoming really conscious about getting our PPE right. Also our hand hygiene moments, we need to make sure we remember 2 when they're donning and 4 when we're doffing. And we must follow the sequence. It's not negotiable. The donning and doffing steps must be done in that order. Now, obviously, when we're doffing, the risk of COVID transmission is higher because potentially we're contaminated. We're not doffing the gowns correctly. So we have PPE spotters out over the last few weeks, and they're consistently seeing staff ripping the ties of the gown off and taking the gown off in a, I don't know what to say, quite incorrectly. And the gown, which we'll show you shortly, must be taken off very carefully, turned in on itself into a ball and contained into the bin. As well, we talk a lot when we're out spotting. We teach staff about doffing masks correctly. They don't doff over the head. We'll show you in a moment how to do it correctly. So they're the key things with doffing. It's a very important sequence. So we need to improve those processes. Hand hygiene still exists and must be followed. The 5 moments still exist. But as well as hand hygiene, we're doing the alcohol-based hand rub a lot, which is the 20 to 30 seconds of hand rub, but most importantly, until the hand rub is dry, because that's when it will have its greatest effect. So how many moments of hand hygiene during donning and doffing? 2 when donning and 4 when doffing. So again, when we were PPE spotting, we noticed a lot of staff come in to start donning and go straight to the gown. It's very easy to forget those things, and that's why we have spotters out in the clinical areas helping to support safe practice. So this, I won't read through this entire slide, but just in the left-hand column, you can see the donning sequence is gown, mask, eyewear, glove. I have an easy way to remember the donning sequence. I just think go Meg. Go for gown and Meg, mask, eyewear, glove. It kind of flows for my brain anyway, and it works for me. So go Meg, gown, mask, eyewear, gloves. I usually taking it off, doffing. I don't have a nice easy acronym for you. You can make one up if you like, but it must be done in that order. Gloves, gown, then eyewear, and finally mask. So let's have a look in a bit more detail of the correct donning process and how to safely don your PPE. We're going to get Kira to demonstrate as I talk through. Right. Okay. So, resume slideshow. Thank you. So the first thing we do is make sure we are bare below the elbows, and we perform hand hygiene, which we just saw Kira do, 20 to 30 seconds until your hands are dry. Then we don the gown. You need to pick the gown that is correct for your size. It must be long sleeved. And what Kira's going to show us 3 things about putting the gown on correctly. It must be tied in a bow at the neck and at the waist, because we need to easily undo that bow when we're doffing. That's where a lot of people are coming stuck. The bow isn't easy to undo, so they're ripping it, which increases the risk of transmission. Kira's making sure she covers her entire torso, at the back especially where she can't see. And she's tying the bow at the waist, not at the front and not at the back, but at the waist of the gown, also in a bow that's easy to be untied. Click. Can we click the slides? Excuse me. Sorry, that's okay. Sorry, just. We're just fixing some slide malfunction. Very good. Hang on, just before you do. I've got no. Sorry, everyone. Just bear with me for a few seconds. I can't. Okay, sorry about that, everyone. I haven't got the slides, but I am going to leave you with seeing Kira, because that's the most important part of this session. So Kira's now going to put on her fit tested respirator. Now she's putting it on in a certain way that you're going to see in the video going forward, where the bottom strap goes on first, below the ear, at the crease of the neck, and the top strap goes on at the crown. She's then making sure it fits correctly by making sure the straps are straight and not twisted, because this will impact potentially on the seal. She's then going to do the pinch and pull. So underneath there's a little tab, so she'll pull it, and that way it will be very comfortable with her face. Yeah, perfect. And finally, she's going to do the fit check, this all-important fit check, which must be done every time, which is a diamond check, where she checks for a leak of air above and below the respirator. That must be done every single time. If you are wearing spectacles and then over spectacles goggles, you need to take those off while you're putting on your respirator. Because when you put on your goggles, they must go over the straps of the respirator. Probably over 50% of the time walking around the hospital, people have, and they don't know, they have their goggles or their spectacle arm underneath the strap of the respirator, meaning there's a risk that the respirator is not providing the complete seal that we need. And then hand hygiene is what's done before Kira will don her gloves. So what's most important about donning your gloves is that you cover the cuff of the gown. So you can pull the cuff of the gown halfway down your hand, and that will make it easier to cover the cuff. Right. So if you have a PPE spotter with you when you are donning your PPE, they might say to you, that's great, Kira, just turn around and I'll check that your PPE is all intact. And then the spotter might say to you, that's fine, you can go ahead into the area. So that is the steps of donning. The videos. So what we're going to show you now are 3 important videos, because they show the 3 different ways that you must safely don your fit tested respirator.
Flat style respirators. There are 2 types, the SD Pro Shield and the Halyard Fluid Shield. Open the respirator up, placing your index finger between the straps of the respirator and bringing the respirator to your chin. Leaning forward, placing the top strap at the crown of your head and the bottom strap at the crease of your neck. Confirm both straps are flat against your scalp, free from your ears, hair and jewellery. Using both index fingers, with equal pressure, mould the metal nose and band across the bridge of your nose and cheekbones. Step 1. Diamond fill for air. Hands together in a half diamond. Place slightly above the respirator, breathing in and out to fill for air, escaping. Palms touching, place your hands underneath your chin. If no air escapes the respirator seal, you may continue. Step 2. Puff test. With a mirror or colleague, inhale and exhale sharply. Again, no air should escape the respirator seal. If there is no air escaping the respirator seal and you feel comfortable and confident in your fit check, you may proceed with your duties. Cup-style respirator, the 3M 1860. Holding the respirator in your non-dominant hand, placing the respirator to your face, taking the bottom strap to the crease of your neck, finding the top strap and taking it to the crown of your head. Confirm both straps are flat against your scalp, free from your ears, hair and jewellery, with no twists. Generally, this respirator has a firm noseband and doesn't require moulding. Every time you don an N95 P2 respirator, you must perform a fit check. Diamond feel for air. Hands together in a half diamond, placed slightly above the respirator, breathing in and out to feel for air, escaping the respirator seal. Palms touching, place your hands underneath your chin. If no air escapes at the respirator seal, you may continue. If you feel comfortable and confident in your fit check, you may proceed with your duties. Cup-style respirator. Modern flat-style respirators include the 3M 1870 Plus and Trident model. Holding the respirator in your non-dominant hand, taking the bottom strap of the respirator and placing it over your middle finger. Opening the respirator and creating a cup. Placing the respirator underneath your chin and taking the strap from your middle finger and placing the bottom strap at the crease of your neck. Finding the top strap and taking it to the crown of your head. Confirm both straps are flat against your scalp, free from your ears, hair, jewellery and twists. Using both index fingers with equal pressure, mould the metal noseband across the bridge of your nose and cheekbones. Every time you don an N95 P2 respirator, you must perform a fit check. A fit check for flat-style respirators includes the chin pull and diamond feel for air. With one hand, hold the nose. In your other hand, pull the chin tab. Smoothing as you go. Flush against your neck. Diamond feel for air. Hands together in a half diamond, placed slightly above the respirator, breathing in and out to feel if air is escaping the respirator seal. Palms touching your hands underneath your chin. If no air escapes at the respirator seal, you may continue. If you feel comfortable and confident in your fit check, you may proceed with your duties.
Okay. So depending on which respirator you're fit tested to, you need to be familiar with how to safely don your respirator. And from those videos, you've seen that there are specific ways to don. What we're seeing a lot as spotters is that your respirator is not being donned correctly. This is something we can fix and correct now, given that we're going to be putting them on at least once, maybe twice a day in our shift. Those videos are online, so you can review them at any time. So let's talk about doffing PPE. The order of doffing, just before you start, is the gloves, the gown, the eyewear, and the respirator. So there's specific things to get right with each piece of PPE. When doffing the gloves, you want to take off the first glove, just touching the outside, roll it into a ball and put it into the gloved hand, and then going underneath the second glove, trying not to touch the outside. It's taking it off down straight into the bin, and then performing hand hygiene. Next, that's doffed is the gown. So because you've just done hand hygiene, undo the bow at your neck first. You're taking your hand up past your face. So undo the neck first and then the bow at the waist, using only the hand next to the bow. And when you're taking the gown off, the aim is to take it off as slowly and carefully as possible, aiming to touch only the inside of the gown if possible, and not letting the gown touch your underlying clothes. You'll see Kira is rolling it in on itself, so none of the outside of the gown is exposed, and hand hygiene. When removing the eyewear, the safest way to remove it is by touching it as far back from your face as possible and taking it forward off your face. Putting the goggles, if it's goggles that you have on a surface, and hand hygiene. We'll talk about cleaning the goggles afterwards. If you have spectacles, you will need to doff those at this time as well. The last piece of PPE is the respirator. You don't want to touch the front of the respirator. You want to take the two straps and touch them only at the back. That's it, and down, doffing the respirator down into the bin. So you're not touching any part of the front of the respirator, and hand hygiene. So when cleaning the goggles afterwards, the policy is saying we must clean them with a Clinell wipe, which we may have to simulate as well. Got our wipes, we can there it is, there's a Clinell wipe. So you clean the inside of the goggles first. No. And then you clean the outside. And you should be cleaning those goggles for up to 60 seconds with the Clinell wipe. Once cleaned, they are available for someone else to use on the donning station, and then you clean the surface of the table where you put the contaminated goggles on originally. If you're wearing a face visor, that is donned directly into the bin because they are single use only. And someone said to me, one of the things we've observed with the face visors being donned, someone said to me, they're being worn like a sun visor. So the face visors are not a sun visor, they're a face visor, and they need to be flush with your face to provide the best protection for you. Okay, thank you very much, Kirat. So we'll just watch this video. This just reinforces doffing your respirator. Okay, so what I'd like to do now is to show you a video, and we've put some glitterbug on my colleague's gloves and gown, and we just want to show you the potential transmission of the virus when we practice doffing that's not as we've just described. So as you're watching the video, I'd like you to think about what's done well, but what could also be improved in this scenario. So the gloves are doffed. You'll notice that she goes straight to undo the gown without performing hand hygiene. It's difficult to undo the bug, so we need to think about that when we're donning. That comes across the gown, increasing the risk of contamination. And we do see this a little bit in practice still, is the gown rubbing up against the underlying clothes, so we aim to avoid that. Doffing the goggles was too near the front of the face. Again, no hand hygiene in between the steps, and the mask has come off. I know it's a surgical mask in this scenario, but it's come off touching the face. So when we look at the face, we can see the potential contamination and how easy it happens. And that's why we endorse the particular steps of safe donning and doffing. And finally, just some important points to remember. Follow the steps. If you don't know the steps of donning and doffing, just read the signage, and hopefully we can get some PPE spotters to those stations. And when you see them, they will have a green sticker that says, "Hi, I'm your PPE spotter." They're here for you to ask questions and to help you. Once you've donned, we need to be very conscious about not touching our face. So when we're putting on, for example, our eyewear or our visors, just do a little gentle shake to make sure it's not loose, so we can fix it before we potentially become contaminated. Gloves can be changed between procedures on the same patient following hand hygiene moments. And if we need to leave the room, we follow the correct steps of doffing, and there'll be signage there at the doffing station. Because if PPE becomes damaged or wet, it's no longer effective. We ensure all PPE packaging is intact, so only open the PPE packaging at the serrated components. So that's the PPE training session, the mandated annual session. We talked about respirators, safe donning and doffing in the correct sequence, and what constitutes a breach. As I said, this session is also available online. You can review it at any time on the COVID tab in HealthPoint. And as is also said, we are training up many PPE spotters who can come and help you don and doff in your clinical areas. So if anyone does want a spotter to come to your area, just email CNE and we'll provide someone. So thank you for your attention. We'll take a list of who's attended this session from MS Teams. You don't need to do anything. If there was a group of you watching one MS Teams channel, you will need to email the names of the other staff watching to CNE so we can get you uploaded to Lattice. Thank you.